Welcome to Optimal Health Weekly with your host, Steve Adams. This podcast is for highly driven professionals, CEOs, and entrepreneurs who know health is the first wealth. Join us each week for a mix of expert interviews and solo episodes on health topics relevant to your busy life. Let's elevate your health together.
Hi, this is Steve Adams here at Tiger Medical Institute. Welcome to the weekly Tiger Optimal Health podcast. And today we have our Chief Medical Officer, Dr. Matthew McNamee, on with us. Welcome, Dr. Matt.
Thanks, Steve. Appreciate it.
Yes, we're excited to have you. And I'm excited about today's topic, and that is the topic of autoimmune disorders. Dr. Matt, we were talking before we recorded about, the common contributing factors. And I want to get to that, but can you talk about autoimmunity in general? Like, help the audience know, like, what is it we're talking about? And, what are some of the common things people feel when they might be like creeping into that or have it full blown?
Sure. Yeah. So, real simply, autoimmunity is when your immune system gets confused with basically thinking that, your own tissues, your own cells are foreign, essentially, right? So they confuse them with like it'd be a pathogen, right? So if you've got a bacterial infection, something like that, it looks at it, says, hey, this is not, this is a potential threat kind of thing. And then it will say, let's get rid of this. And so it basically confuses, the very simplistically, the outside world. So, everything outside of us, inside world. We're supposed to, basically, troll our systems and look at, our body and then distinguish ourselves from the outside world, right? And then that's where it kind of gets, caught in between there as it starts attacking self, and then what more commonly translates to is, rheumatoid arthritis is pretty common. So that's where it attacks the joint tissue. People get inflammation with that. Hashimoto's thyroiditis is an autoimmune condition where your body, attacks the thyroid gland. Fatigue's real common with that. Fatigue, weight gain, brain fog, depression, or constipation, things like that are pretty common with that condition. There's several others too. Celiac disease is on the rise. I mean, that's where if you consume gluten, it triggers your system to attack your intestines. You get, gastrointestinal symptoms with that. So, it really depends on what tissue.
Yep. Right.
And, if it's the brain, then you're going to get neurological, problems. Right. So,
what I'm hearing though, is it's probably a complex set of symptoms typically.
Yes, 100%. Yeah. It's very specific to the tissue being damaged.
Right.
So it's right. So if it's the joint, people get stiffness and pain, and sometimes heat and warmth in that area, and swelling, so it really depends on what's being affected, and how long you've had that going on. I mean, autoimmunity takes many, many years typically to develop, up to even a decade or sometimes longer.
Right.
So don't just wake up and have it, overnight. It brews, and there's actually an asymptomatic phase, right? Or a pre-symptomatic phase, right? So before symptom onset, individuals can be in this window where they feel fine. I had a conversation with a gentleman a few weeks ago. not only had, antibodies to his thyroid gland, but also had another general autoimmune marker that we use to screen called an ANA, an anti-nuclear antibody. He just said, I feel fine. Why would I want to do anything about this kind of thing? But kind of simplistically, right? And I just said, you're in this pre-symptomatic phase that if this is, not addressed, there's a very, very, very high likelihood this is going to continue to get worse. And then when there's enough tissue destruction, that's when symptoms onset start. Right? So it has to be destroyed enough that, that then the onset of symptoms associated with that start. So
I've heard you refer to that as the smoldering fire stage. Kind of, it's underneath the hood. Mm-hmm. Is that kind of how you explain it to clients sometimes?
Yeah, sometimes I'll use that analogy for that. It has to be. It's kind of, that same analogy goes with just like chronic low-grade systemic inflammation. Right. Sometimes people don't even feel that, right? Or it's so minor you can't really, associate any symptoms or anything with that. But it's kind of like the smoldering fire, right? And
and so real quick, I mean, how we talk about this all the time about, if the client is in the middle here in this little picture, traditional medicine's approach, I'm simply speaking facts. I'm not making an opinion about it, is to come from the top down. There is emphasis on diagnostic, classifying it, and then treating the symptom through usually a pharmacological solution. Whereas Tiger Medical, the way you do medicine, the way Dr. Kessler does medicine at Tiger, we're from the bottom up, and we're looking for the underlying mechanisms that are driving that. So in a traditional setting, if someone is becoming symptomatic with an autoimmune, how are they testing it, and what's their typical solution?
Yeah, so I mean, if testing depends on, what
the symptom is,
the suspicion is, right? So if you're suspicious, it's this tissue, there's certain type of tests. If it's this tissue, it's other tests. So they're all very unique to the actual type of autoimmune condition. Mm-hmm. So that's typically, and takes the individual's history, family history, all that stuff, coupled with, what the clinician is, seeing on physical exams and other, lab results. And so it's a clinical kind of, decision process where, and they can look at, well, let's look at these and look at this. It might be this, and start, kind of testing some of those things. If they find, you've got antibodies to this tissue or this tissue, it's not uncommon that medications are prescribed, right? And kind of many of them just kind of dampen the immune response to kind of pump the brakes on the smoldering fire.
Right. Yeah.
Up a little bit more sometimes if it becomes more aggressive and what myself and Dr. Kessler do. I mean, we both do the diagnostics aspect, right? So we have to know what we are working with, right?
Yep. So on a contrast, how would you test that? Do you have broad markers that look for it everywhere, or is it still tissue?
I do use a company that they literally are a very specialized company that specializes in autoimmunity. Mm-hmm. So they do have a very it's kind of like a head to toe panel that I will run on some people. Mm-hmm. And especially if they even already have, if they come to see me, they already have an autoimmune condition. A lot of times we'll consider running that just to see if there is anything brewing in any other tissues, because it's not uncommon if you get one autoimmune disease, there are certain ones that have a higher probability of getting other ones.
Gotcha.
They can be linked.
So this is why it's so important to catch it early then when the smoke and fire.
So we can check that, but I mean, it's a good test. It gives us, some ideas on different tissues. It's not like all-encompassing test that'll look at everything under the sun. It does look at everything from brain to bone to heart, to muscle to joint, thyroid, gastrointestinal tract, et cetera, right? So it does look at a lot of stuff, pancreas, right? But there's many other times you have to add additional tests on to that, right? But another thing that myself and Dr. Kessler do in concert with that is, right, we get a baseline, we go, okay, this is likely, the type or types of autoimmunity we're looking at. Let's get a baseline, because our approach is, let's address the things that, started this in the first place. We can't do much about the genetic component. There's typically 3 legs that contribute to this process that Dr. Alessio Fasano discovered, that basically correlates with all autoimmunity. He teaches at Harvard, and he basically got into finding out that, there's actually a little more than 3, but very commonly there's this imbalance of the good versus bad bacteria in the gastrointestinal tract. So that's
number 1.
That's one of the one of the main components. That creates inflammation in the gastrointestinal tract. So then you get the inflammation with it. The inflammation creates gastrointestinal permeability, or more permeability. So basically, you're supposed to basically take up very small molecules, nutrients, things like that from the gastrointestinal tract, and then take and avoid the large molecules getting in, things like undigested food particles and, bacteria and other microbes, right? And then larger toxins and stuff. That stuff's supposed to stay in the gastrointestinal tract. What happened is, from the inflammation, I always kind of use the analogy, it's like using a screen window in your home, like maybe during the summer, spring, fall, something like that, when the windows are open to keep the bugs out. And then with the gut permeability, or leaky gut syndrome, they'll call it. There's it's kind of like just leaving your front door open, right? All this stuff can get in, right? And then that's where the next kind of step of the process, where you've got about 80% of all of your immune cells are located in the gastrointestinal tract. So what happens is, they're there, right, distinguishing friend from foe, right? So what's healthy, what's okay, what are we okay with, what's not. And all of a sudden, you got the gates are down, and everything's flooding in, and it's the alarm.
So it's attacking everything. Yeah.
So that's where, really, coupled with the genetics, most people like myself, I've got, quite a few people in my family with autoimmunity. We have this genetic component. So most people have to have basically a genetic component and then the perfect storm, right? So, and a lot of people have suboptimal gastrointestinal health. And I would say at least half the people, I've probably checked over 1,000 stool samples over the last 15 years. I would say about half of those individuals are asymptomatic. My gut health's fine, no issues, right? But they still have that kind of smoldering fire in the gastrointestinal tract. Their microbes are out of balance. So not to say they're going to get autoimmunity. There's all kinds of other, issues, and things that can cause dysfunction from that. But
Matt, can I ask you a question real quick on the genetic component of autoimmunity? What is it that you can do there? Do you talk about that a little bit? Because I think when I hear you say that, in my mind, I think, well, that's fixed. I can't do anything about that.
No, it's not fixed at all. I mean, it's so there's another functional medicine physician. I don't know if it's he that coined it or someone else. Basically, genes load the gun, very simplistically, environment pulls the trigger, right? So just because you have the genes does not mean that they get turned on. Green light switch. They could be a red light your whole life and actually never get turned on. Yep. So not everyone with a genetic predisposition for this is going to get autoimmunity,
Okay.
So, it's pretty common that genes that we normally don't want to get expressed or that can be problematic for us are commonly triggered by, things in our environment, environmental toxins. Our lifestyle is a big one, nutrients, and typically it's poor nutrition, right? Suboptimal, nutrient intake. All that stuff, basically signals to the genes, and it changes. So all of a sudden these things can be dormant, and all of a sudden it goes, no, let's turn this on, right?
Yep.
So that's part of the process. Part of the process is that. Part of the process is it's not just the genes that get turned on, it's how your immune system is genetically kind of programmed. Part of it's a programming, and then, when the floodgates are down and you got all that inflammation, and just so everyone knows, inflammation is governed by the immune system. So 80% in your gastrointestinal tract, those immune cells, and when those things get turned on, they don't know what to do. All these foreign things are getting into the bloodstream. Some of them look close enough, not identical, but close enough. They can be one amino acid, which are the building blocks of protein, structure off, but your body will still create antibodies. Oh, that gluten molecule looks like thyroid. The gluten molecule looks like joint tissue, right? So that's where, or there's specific pathogens. Some people have certain microbes in their body that can actually trigger. They can be they call it cross-reactivity, meaning you get a microbe, you start tagging that with an antibody as foreign, and then it cross-reacts with your cell tissue somewhere. So microbes can do it. Different pathogens can cause autoimmunity. Certain foods can cause it. Like there's a link with dairy products and MS, right? And then, environmental toxins, right? These things are foreign. I think we had about, 10,000 known toxins in the environment in the 1950s. We've got over 80,000 now, right? And
wow.
It takes our body thousands of years to adapt to things, and we've got this, onset or, kind of bombardment with our bodies with these foreign, chemicals. It's still trying to figure out. We don't know what to do with it, right?
Right. That's true of our lifestyle in general right now. Our bodies aren't learning how to adapt to modern life. Steve Adams here from Tiger Medical Institute. Do you ever feel like you're operating at less than 100%? It's time to take control of your health with the True Health Assessment by Tiger Medical. Get comprehensive blood screening to identify hidden health risks before it's too late. Our team of Mayo-trained and naturopathic physicians will analyze your results and provide a custom plan to optimize your well-being. Don't let underlying issues hold you back. Invest in your most valuable asset, your health. For the price of a daily chai latte from Starbucks, you can gain priceless insights and a roadmap to peak performance. Visit truehealthassessment.com, truehealthassessment.com today, and unlock your full potential. Because when you feel your best, you can achieve your best. That's true health.
And what happens is, there's even links like, right, a lot of people have heard about BPA. You can look at a lot of products that will say BPA free, right? So BPA can bind to thyroid tissue, and it basically creates a new molecule. You got your tissue with the BPA bound to it, and that'll drive autoimmunity. So it's not just even the toxins in the system. They can actually, some toxins have an affinity, where they're attracted to certain tissues. That'll trigger this autoimmune response as well.
Yeah. So question for you. This is so fun to geek out with you like this. Tell the audience, so as a naturopathic physician who went to medical school, like if anybody listens to Dr. Matt talk, they know you went to medical school. What is the, in layman's terms, like how do you approach treatment then for just call it general autoimmunity, not going down the rabbit hole of an individual one. What is your approach and how is that different than what traditional medicine's doing?
My approach is really like anybody that practices a functional medicine model.
Mm-hmm.
There are three things that, some of my mentors who are internationally known and well-respected speakers and experts, right?
Yep.
Say some of them will say, every single person has an autoimmune condition. We do this, and this. Three things that are absolutely fundamental. I don't necessarily do all three up front, but the number one thing, I suggest everyone with either an autoimmune, either an autoimmune condition, an autoimmune, something that could be potentially brewing, right? There's concern, or if someone wants to get ahead of it, if they just wanted to make a lifestyle decision, right? There's other benefits to it as well. Right. But gluten is one of the most cross-reactive agents, right? So it's I've got a lot of really awesome information I get from that, the scientific data I get from that autoimmune company, that if you get a specific, antibody to a certain tissue, you can look at a spec sheet and look at everything that's ever been in the scientific, literature that would correlate with basically a trigger, right? Cross-reactivity. What can correlate with this? And you go, okay, are those things in your environment, in your life? Is it, and then if we can pull them out, then you're not adding gas to the fire, basically, right?
Right. Yep.
So,
so that's the first thing.
One thing, yeah.
Yep.
So gluten, I would say gluten-free. Always address gastrointestinal health. Like I said, Dr. Fasano said that's the building blocks, right?
Yep.
If your gut's off and you've got the leaky gut thing going on, it has to be turned off, right? So you have to go through the process to address your gut health, right? And that's typically a multi-pronged approach, right? So, and then there's a lot of my mentors and that, and I use sometimes something called low dose naltrexone, we call LDN for short. It is a medication that's made from a compounding pharmacy. It's a microdose of a normal medication that we use for something else out there, and it has very different effects on the body versus the very high dose one. Well, it's all in relation, right? Versus very micro doses of this thing, and it modulates the immune system in a really positive way. So it can kind of deepen the autoimmunity. So for example, I've got someone I'm working with Hashimoto's right now. We're going to address those first couple things, and then check. You got to get a baseline, right? So we got a baseline. She's getting this week, right? Yep. Where are your antibodies? I have a history where they've been at the last 10 years, so we can see trends, right? And then we can retest as we continue to go through, treatment protocols and such. Right? So, and then if they're not coming down, and this is what happened to my sister. My sister had a pretty complex case of Hashimoto's. She had some other stuff going on as well, and she ended up seeing a mentor of mine in Arizona. Started her probably on some similar stuff like I would do, and the antibodies weren't coming down enough, and they started an LDN and they just plummeted, lowest they've ever been in her whole life, right?
Wow.
So it's almost normal, and she probably would have one of the higher numbers that I've ever seen, right? So yeah, so it can be very beneficial, but there's other things that we can do that can also help modulate the immune system as well. So a lot of times I'll start with those. And if we're not moving the needle enough, then it would be looking at, maybe doing the low dose naltrexone. Those are some fundamentals. A lot of people can benefit from possibly pulling out other foods because it depends on what condition they have. Some may need to be.
Do you use genetics for that? Like you can look at the things they're predisposed to not doing well with. Is that helpful?
I wouldn't say genetics as much. It's more finding out specifically what autoimmune condition they really have, and then looking at, okay,
got it.
Those are known, very hard, very evident in the science. People with those are, basically it's the autoimmune process where those antibodies are elevated to attack self by exposure to this or this or this.
Right.
Or this, right?
Is that mimicry? Is that when I've heard you talk about molecular mimicry? Yes.
Yep.
Right. Okay.
Yep.
So what I'm hearing is that someone who has autoimmunity, this is not a life sentence. Like, you can address this and get improvement in your life, how you feel.
Yeah, I mean, there's a caveat with that, right? So, I don't know if the gentleman still works there. He's a physician at the at Cyrix, the company I was talking about with the autoimmune testing. He'd help basically work internationally, and he's reviewed probably more of those results than anyone in the world. So he's quite versed with all this stuff, but his analogy is, if your immune system basically feeds on certain tissues in your body, whether it be the thyroid, the joint, etc., for long enough, it kind of switches and goes, this is my new diet.
Got it.
So people that have had autoimmunity for, many years, it's not always common that we can put them in remission or reverse it. Sometimes if they've had it long enough, there's enough damage that's been done, we can, probably get them sometimes in remission, sometimes close to it. But I would say almost anybody, if they've never tried, they've never worked with a functional medicine, practitioner, and they haven't tried anything on their own, I would say you'd be able to get a positive impact on most of them with quality of life for sure.
Right.
But they still may have issues because it's just one of those things that they've had it long enough.
Yeah, the diet is now set. So if you get people like this gentleman you spoke to a few weeks ago, though, and it's in the smoldering fire, they're asymptomatic, you can probably have a big impact there.
So much easier. Yeah.
Yep.
That's like just nip it in the bud and ideally prevent it, which should be in that case pretty easy, right? So that's ideal, and that's where if I ever run that test, the one from that company I was talking about, the autoimmune company, that they basically have a green, yellow, and red kind of column.
Yeah.
And I ideally want everything in green, and even if you're in the yellow, that could be an indicator that things are brewing, and you could be just in the pre-symptomatic.
Right.
So
well,
I've had plenty of people that are in the red, that there hasn't been enough damage yet. They're still in the pre-symptomatic, right?
Nice. Yeah.
So,
right. Well, I know with me, I mean, you recently got me off gluten, and you're addressing my gut health for a second round after 5 years ago you did. We're hoping that we're going to get ahead of that, because I don't have any big autoimmune symptoms right now, but you were saying that you had a little bit of concern about that, so we need to address this. And so I just think the core message of what we're talking about here is it is possible to address these things. And it's empowering to know that, because you can actually kind of rewrite the narrative on your health future if you choose to engage in a process like this. Matt, I mean, if you were to guess, have you seen any numbers in the research, like the level of the percentage of the population that's dealing with some level of low grade, medium grade, or high grade autoimmunity?
I don't know if they've got. There's been a couple researchers out there that have done studies on specific autoimmune conditions that have looked at pre-symptomatic versus actual symptom patients, and I don't recall the stats with those. That was a while ago. I looked at that.
Do you have a sense of the number of people that have come into Tiger Medical in the last 4 years?
I would say
that are at any phase?
I would say even Tiger and just my career practicing, I would say probably maybe 20% or so.
Yeah.
Maybe even a little higher.
Mm-hmm.
You know.
Right. And a bigger percentage have some of those problems like gastrointestinal imbalance or inflammation. You know what I mean? The things that you address.
Mm-hmm.
You know, we see
I would say it's probably a little higher because there's quite a, you know, sometimes the standard, you know, reference ranges for some of those markers. I mean, thyroid autoimmunity is very common. And a lot of times those individuals may even get like a thumbs up, like your antibodies look good, and actually they're not optimal, right? So there's optimal range versus so there's quite a few people out there. In fact, even I would say in the last few months, I've probably seen, you know, half a dozen to a dozen people.
Yeah. Wow. Yeah. Right.
That's just thyroid. Now, if I were to look at some of the other autoimmune markers that we look at screens, there's probably, you know, 20-25% just for the other one, you know, so
right.
Those can be independent of each other. They don't have to happen at the same time.
So as a root cause medicine or a root cause doctor, a naturopathic physician, I mean, what would you say people listening, like, why should they go down this road and potentially work with a Tiger or another functional doctor versus just only relying on the traditional medical system, in your words?
I think it just depends on what approach they prefer, right? So there are some people, I can think of my grandma, for example, who's just set in her ways, right? She actually has an autoimmune condition, right? She's on medication for it. She's not super healthy at all, you know, doesn't really take care of herself. And, you know, so there's people that, you know, are, you know, content with the way that they're living, or they don't want to change, because honestly, this stuff it's not like we just prescribe some stuff and you take it and you get better. It actually takes work, right?
Yeah.
To heal the gut. I mean, a lot of times we have to change the diet. You know, yes, we can add some things that can help heal the gut and help with the microbiome and all that, but it takes work, you know, so there has to be, you know, some sort of motivation
and commitment,
willingness, I guess, to, I'll consider if, I mean, here's the deal. If people actively have an autoimmune condition and it's not being appropriately addressed or managed through conventional care, they're probably uncomfortable, and some of them can be quite miserable.
Yep.
Some of them, it can affect them as much where they can't work, and you know, it can really have a huge impact on the quality of their life.
Right.
So those individuals, I tend to, you know, it's not uncommon. I've seen those out throughout the years that I'll do anything.
Yeah.
You know, I started working with a woman last month, Hashimoto's. You know, she's being seen by, you know, some conventional physicians, and I'm going to help her with some of the stuff that we spoke about.
The goal of having you on the podcast, one of them is when people hear root cause medicine and lifestyle changes and natural interventions, sometimes I think that they have the impression that it's not science. And when you if you listen to this podcast today and listen to how you described your process, they're going to come away going, this is deeply rooted in science. It's just that the tools we use are different.
Yeah, I mean, you could look up, it's pretty simple. You could look up Alessio Fasano's work. There's some people that think he'll get the Nobel Prize for, you know, the research that he's done. You know, he's teaching this model at Harvard. And, you know, he's got a lot of great, you know, papers out there. That's just one example, right?
Right, exactly.
But he you know, that's a lot of what he's done is, you know, helped us myself and other, individuals in the medical field to utilize that as kind of a framework, coupled, there's some other great, scientists and physicians out there too. So, but yeah, it's deeply rooted in the science. It's not green allopathy, where it's someone comes in with a condition and I'll give you, instead of a medication, this for it. No, it's why do you have it?
Right.
Okay.
Yeah.
This is what's actually the nuts and bolts behind it. Let's address that and hope you don't take anything.
Right.
I mean, that's the goal.
That's the goal. Right. Well, Dr. Matt, thank you for appearing on the Tiger Optimal Health podcast today.
My pleasure, Steve.
Steve Adams here from Tiger Medical Institute, talking about the True Health Assessment. What if you could safeguard not just your health, but the well-being of your entire family? With the True Health Assessment from Tiger Medical, you can. Our comprehensive blood screening identifies hidden risks before they become major issues. Our elite team of Mayo Clinic trained and naturopathic physicians then create a customized plan to optimize your health for years to come. When you prioritize your wellness, you ensure you can be fully present for the people you love most. Don't let preventable issues cut that time short. For less than the cost of a daily latte, you can gain peace of mind and a clear path to sustained vitality. Protect your future and your family's future with True Health Assessment from Tiger Medical at thetruehealthassessment.com. Again, that's at thetruehealthassessment.com.